Welcome to our discussion on culturally respectful care. This is week 4. So, cultural diversity, there's a ton of terminology in this chapter, by the way, and some of it seems very similar to the next. I would tell you that with healthcare disparities being a very big focus of healthcare right now, I would expect to see questions about cultural diversity and healthcare to be on your HESI, and also perhaps even on your NCLEX exam. So be familiar with the terminology and the various nuances. So cultural diversity is being aware that there are different ethnic, racial, socioeconomic groups, and that can all be within one unit of culture. It can be all within one person. And there's so much diversity that there's no way one of us is culturally competent enough to understand all of the needs of an individual when it comes to cultural beliefs. So you can see the list there of all the different cultural ways that people have cultural diversity. For example, you could have cultural diversity with a subculture within healthcare would be nursing. So that's an occupational subculture. Let's go to the next page. Culture is a shared system of beliefs, values, and behavioral expectations. And that's based on a lifetime of acculturation within whatever that culture is. So you have acclimated and grown up and been taught certain beliefs and values and expectations. So that is what culture, the main definition is. And it helps to provide social structure and norms for what is the expectation. I think I went the wrong way. I did. Subculture, next page. That's where I was saying that even though somebody may identify as I was born a female and I was raised in a Lutheran household, but I'm no longer practicing that religion and I'm more spiritual now. So those are the types of things that you would want to uncover in your conversations with your patients so that you can treat them as they want to be treated while they are in your care. Groups in society, I think we already can see that. There's dominant groups, usually the largest ones, and minority groups. That is not always the case. Look at South Africa during apartheid. Cultural definitions. Okay, so cultural assimilation is when, it's kind of what's happened in the United States over the last couple generations. We have a lot of people moving to the United States, and just the fact that we are a multicultural world, like we fly all over the world on a blink of an eye. So cultures are melding. So as we live closer together, we assimilate, and usually the dominant group, their traits overtake the values of the other cultures. So that's cultural assimilation or acculturation. I'm trying to think. Well, if you look back, maybe even 50 or 60 years ago, most of your cities had specific neighborhoods, and those were the neighborhoods where that ethnic group lived. So I'm thinking New York or Chicago, the bigger cities. You had Polish neighborhoods, you had Italian neighborhoods, you had your Hispanic population, you had your Asian population. So they all lived in their own areas, and now they're very much more of a melting pot. I'm going backwards. I don't know what I'm doing here. Sorry, guys. So ethnicity and race are sometimes used interchangeably, but they are different. Ethnicity is more how you identify with a cultural group. So it could be through birth or it could be through adoption, but it's, let's say that you were born Italian, but you were raised in an Irish family. So your ethnicity, you may identify more with an Irish ethnicity because that's the food you grew up with and the folklore you grew up with and, you know, the rules you grew up with. So that's ethnicity. But your race is more about your physical characteristics. And that is becoming more hard to, again, define as we become more of a melting pot society. So these are the 5 major categories here on this slide that people may identify with, and some people identify with multiples. So let's talk about things that inhibit sensitivity to diversity. No matter how hard you try, I challenge you to not find something that you stereotype about. We all do. And sometimes I feel like we do it a lot. We do it without even thinking about it. So, you know, you might think, I don't know, you guys don't hate me. I'm not giving you examples of what I think. I'm just trying to come up with stereotypes. Let's say you say that all Asians are smart, or all Asians are have a high tolerance for pain, or all people from the South are overweight because they eat fried foods at every meal. Something like that. I mean, I know those are crazy stereotypes, but if you think about a certain group of people, you probably have stereotypes about those people. Implicit bias is another thing that we are not necessarily aware that we have, and that bias is through our frame of reference and our upbringing and our experience throughout our life. So I have put, what I wanted to do is put a link, but I couldn't figure out how to do the hyperlink. So copy and paste it to a web browser, and you can take Harvard's test on implicit bias, and just to see what your implicit biases are or how you score on that test. Cultural imposition is another term that talks about how a dominant culture imposes their culture on others. Cultural blindness is where you just treat everybody the same and ignore any cultural differentiations. And then culture conflict is where you realize that there is a difference in your belief system and it's a conflict. So these are just some of the terms you need to be aware of. Let's go to the next page. Healthcare specific cultural influences. I'm not going to go over this for a long time here, but health disparities and socioeconomic factors are a huge focus in our healthcare system today. We're trying to equalize and provide care for people that today maybe aren't getting the care they should be getting. We also want to make sure that we're providing good family support and understanding the cultural influence within that family even. So just for an example, some cultures, the father is the leader of that family and makes most of the decisions. But in other cultures, it's the matriarch is in charge. So you need to adjust how you're communicating with the families in those situations and understand the power dynamics within the relationships in that family. So if your matriarch is the one who's ill, you may find that the family is very confused and fearful and afraid to make decisions. So ask a few questions. What do we need to know about your mother or your wife or whatever? What is her role within your family? And let's talk about what's going on with her, see how we can help. But you need to understand first, what is everybody's role and who has the power? Food and nutrition. So what is the main diet or types of food that the group that the people you're treating, what is the type of food that they like to eat or what they have to eat? So if you're certain Jewish religions, they have very strict dietary rules that they follow. But guess what? Not everyone does. There you go with your subcultures. So maybe you were raised in a very strict religion that you could not have, you could only have kosher foods, no pork, none of that. And then when you went to college, you married a Catholic girl, and now you're not practicing your religion, and you eat whatever you want. So that's different from what you would expect. It's different from the stereotype. It's different from what you might think. So you have to really kind of sit down and get to know your patient, find out what their needs are. Language and communication can obviously be a barrier. I want to tell you that it is so important for you to use whatever your workplace has in place so that you can communicate with your patients in their primary language. It is really never an excuse to say I couldn't find the IVR, which is the video where you can call and get somebody in person on the screen to have a conversation with you and be a translator. There's other options too. There's like 3 or 4 different options, and it's imperative that we do communicate with our patient in the language that they understand. And imagine how fearful people must be to be in a healthcare setting and not understand what is happening and not understand what's being told to them by their medical team. So we really need to make sure we're taking the time to understand their needs, speak to them in the language that they can understand, and ensure that they don't have questions. And then assigned sex roles. We talked about that a little bit, just saying who's a matriarch and patriarch and what type of society. But then also, today we have a lot of people that are reassigning themselves. So, you're assigned male at birth, but you had a sex change operation to become a female. So understanding that person and their needs. Mental health, reactions to pain. So I mentioned just briefly about the stereotype, Asians don't feel pain. Well, it's not that they don't feel pain, it's that they are, in general, many Asian cultures do not express their pain, and they feel they need to be stoic with their pain. So you're going to have to look for nonverbal signs of pain and really educate them on why we want them to take pain medications so that we can keep them out of pain, because they may tell you they don't need pain medication, but it's not that they're not in pain. Let's see. So here's a slide that talks about different cultures may have a variety of practices that don't meld with Western medicine, which is what we practice here in the United States in our traditional medical system. So we need to be very aware and sensitive to the needs of people that practice folk medicine or use healers. Their methods, while not ours, bring them value and in some cases healing, so we need to respect their needs. For example, if you have a Native American patient and they're asking for a shaman to come in, then we allow the shaman to come in and practice their medicine as well. And then the next slide is about cultural competence. So I'm not going to lie and say that there's a book that if you read it, you're going to know everything you need to know about everyone's culture, because like I was saying earlier in this PowerPoint, there's so many subcultures and just individual differences in what people follow from their main cultural identity. The biggest thing that you need to know, understand, and appreciate about cultural competence is you need to have a self-awareness of your biases, a self-awareness of where you may be stereotyping, and a self-awareness that you're not going to impose your own beliefs on someone else. So appreciating someone else's differences and asking them what do they need from a cultural perspective so that you can give them the care that they deserve. And be accepting of differences. It's good to be a lifelong learner, so we don't have to think we are right all the time. We can learn something about someone else's beliefs and values. So I feel like that's enough. I feel like I'm preaching to you guys, and you already probably get it more than I do. Did I skip something? I did. Well, there's ethnocentrism and cultural humility, which are the terms that describe what I was just talking about. So you can read through that slide and know those terminologies, those terms. And then there's some guidelines for nursing care. Again, already said all that. I don't think there's anything there that I didn't already touch on. And same with this. It's pretty much just recapping what we were talking about. So, wow, we're done in almost 16 minutes. Have a great rest of your day with the time we got back from this short little lecture.